I'm Dr. Satish Rudrappa, Group Director at International Institute of Neuroscience, Whitefield, Bangalore. Today, I'll be talking on a new program which we started at Aster Whitefield for the public good, the greater good of the human being. So this is related to epilepsy. Epilepsy is nothing but an electrical activity which comes out from the brain and it just spreads within the brain and patient loses the consciousness, and you might be seeing everywhere. According to the international guidelines, 1 in 10 will, when you talk to your own friends and family about the epilepsy, somebody will tell you that yes, my brother has it, my friend's sister has it, and different variety of stories you start hearing it. But unfortunately, this epilepsy, though it doesn't differentiate the gender, caste, creed, economics, it is very common in low socioeconomic public people. When it happens, it usually becomes chronic. For that reason is, first, they may not be able to get the correct medical help, they may not be afford to get medicines, nor they can sustain it for longer period. So at the same time, when somebody has an epilepsy, it is a stigma in society. In fact, if you hear some stories, there are people who take them to the temples thinking that some demon has come. There are in the villages that they hide the story of these things, and young girls will be married, and once the other family get to know, there will be familial discard. And when it is hidden from the children without a diagnosis, many of the children will not have a good school performance, scholastic performance drops down, and they become useless to the society. So there's so much of stigma attached in this society, more so in India. So based on this, with our great experience, and especially in our institute where we have a dedicated epilepsy center, when we see this social problem, we have come out with a program called as EPIC program, Epilepsy Prevention and Integrated Care Program. And this program is done in association with the Rotary International, and where the Rotary International help us to get, we go there and do the service to the community in the form of camps, only to see the epileptic patients. And those who require the medical help, we do the medical help. Those who require surgery, we bring them to our hospital and we help them. And how does we help? And this program is purely for the people of below poverty line. Where patient cannot afford, we do the free health camp, we do the free medical help. We try to do the maximum capacity to make sure they will get the free MRI, PET scan, and free surgeries. And this is purely for the public good it has been done. And we have already done a significant amount of surgery for these patients. Many patients have got benefited with this. And here, what is our main criteria is to help the needy at the best time so that they will have a transformational change in their own life and indirectly bless us. So in that way, we started this program at the International Center of Neurosciences at Whitefield. At the end of this program, I'll put a small number, the phone number, where a dedicated number only to help these patients, and anybody can contact us, and we are always available on any Friday to come to the to our clinic and avail this benefit whenever it is needed. Thank you very much.